Hello Cocker Minor hockey families, welcome back. I'm Dr. Todd with West Valley Chiropractic. We've had a busy year so far with hockey. We've had the opportunity to work with a lot of kids who have had concussions, and it's been great that some of the parents are able to recognize some of the signs and symptoms. We've had a lot of teams who are interested and have been baseline tested, so kudos to them. The next step or the next stage of this process is my child has sustained a concussion, and now what do I do? The first thing is obviously you've removed them from play, but what do I do now? The next thing that you'll want to do is make sure that you remove all electronics, cell phones, tablets, and make sure they get a lot of sleep. At this point, what you'll want to do is have them assessed professionally. If they're showing up with red flag symptoms, make sure you guys get them off to the emerge. They're very, very dangerous, and you want to make sure that you don't miss those. Now, the assessment, the treatment options, there's lots of choices at West Valley Chiropractic. Here we do a full assessment, but most importantly, the assessment of the concussion is important, but it's the rehab, it's the treatment, it's the options that allow the kids to get better faster, heal faster, and get back to school, hockey, or from the perspective of adults, get back to work faster. So that's really what we strive for, and that's really what our main goal is here at the office. Okay, so with kind of the main goal being getting the kids back on the ice or getting them back to school as quickly as possible, or basically just having people heal as quickly as possible from their concussion. What does that look like? Well, we touched on the biggest one, which is, first of all, removal of the electronics from their world. So like I was saying before, no cell phones, no tablets, no TV, no computers, nothing. And that's going to be at least for the first week. Now the next really, really important part is making sure that they're having the proper VOMS rehab, or vestibular ocular motor therapy. And that's stuff that we do at our office, and it should be stuff that's done at other clinics that treat and manage concussions. The next really important part is sleep. Sleep, sleep, sleep. Sleep is one of the best ways to recharge your brain. So it's not like the old days where it was like you had to wake people up every hour. Research shows that there's a better way, and it's just let the brain sleep, let that brain heal. Diet. There's some important diet modifications that need to be done that are gonna feed your brain healthy food and remove some of the stimulants that don't help your brain heal as quickly as possible. The final part to this is the chiropractic portion of it. If you've just had your brain and your head and your neck rattled, there's a very good chance you need to have some work done with your neck. So that's where you'll want to make sure that the treatment that you're getting done is very, very gentle, super non-invasive, and that's where having an adjustment with something like the activator is very, 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 very helpful. All right, so one of the next questions I get asked a lot is, I had a concussion when I was little and it kind of healed. And the reality of that is a lot of concussions will naturally just heal on their own, thankfully. However, the problem with that is there could be some issues that are left untreated, unrehabbed, and there could be some weaknesses or deficiencies in how your brain is functioning because it doesn't have the ability to heal completely. It'd be the same as if you had knee surgery. Yes, your knee will heal, but if you don't do the proper rehab, it may never heal as strong, or it may never be, you might not be able to train as effectively as if you did have rehab. So that's why I always recommend that if you do have a concussion, have it properly assessed so you can make sure that at the end of it, your brain is just as strong as before when the accident occurred. Now, our next video is going to be a little bit more specific to Cocker minor hockey and minor hockey in general, talking about some of the insurance coverage that you have if an injury or a concussion does occur. If you like these videos, click below. We have other videos online. Rate them, tell me what you think, and we'll see you next time.